Yeah, 200, what's up? So I again wanted to delay things because this was kind of a heavy week for you guys having to do your critical thinking assignment, okay? And this is heavy because it's biology and you're not biologists, but I just just want you to kind of appreciate what you're getting exposed to because these are life skills. The reason we throw these diseases up here into GERO 200 is they're so common, and you're going to have to deal with this. Many of you, either directly as a patient, directly as a caregiver for your parents, grandparents, or kind of indirectly through friends, but and indirectly also through kind of societal financing. This is the most significant drain on society is what we're going to go into today that was piggybacking on diabetes. All right. So I'm going to scroll down here. There's the team. I love the team. All right. And we're going to go right into our next assignment. All right. So like I said, we did cancer. We ended diabetes. Do understand that there is, when we did diabetes, there is a major genetic predisposition for this. You don't ask for it. This is what you get. Um, I had the gray hair here. I have the Irish skin. It's just, it is what it is. And I have a predisposition for arthritis. Okay, so you don't ask for the diabetes, and then you piggyback on that. A lot of choices that we make, and some of them are not, our own choices. It's just part of being social and the way we eat, the way restaurants deliver food in excess, and then lo and behold, boom, from a long-term kind of excessive diet and obesity, we get thrown into diabetes. And diabetes is a risk factor for heart disease. It's also a major risk factor for cancer. And then we're going to find out later on, it's a major risk factor for Alzheimer's disease. All right, so it's something that, we get diabetes in youth in a lot of our children, and it's just something that has to be controlled. Okay. All righty, so we're going to go into here, the metabolic syndrome. What does that mean? It's just a syndrome where so many aspects of your life and your metabolism is influenced mostly by that diabetic condition. So again, this video is going to be going right in here, okay, diabetic heart disease. So what we want you to do is to launch yourself into this website, show some curiosity, okay, as always. All right, and I'm going to give you the big picture overview on this. Okay, the NIH obviously has a lot of information about the coronavirus and the disease that's called COVID-19. If you're interested, okay. All righty. So, what is metabolic syndrome? So you just click on here, and it gives you real quick information. All right. Health problems such as diabetes that leads to stroke. Okay. So again, these are hyperlinks that will take you to that information. All right. Um, you have risk factors, traits, conditions, habits. Okay. So what they talk about here, risk factors are genetic traits. Okay. And then habits, which are lifestyle. Okay. That can lead to ischemic heart disease. What is ischemic heart disease? Well, you click on this to tell you. Ischemia is when tissue does not get its oxygen. Okay, why is it not getting its oxygen? Well, that's because the diabetes is a predisposition for atherosclerosis that causes these plaques that basically are, see, I just had a little cheese stick, okay? So this is my normal artery right here. It's okay, it's all big. And then what happens is you get plaque inside the artery, okay, right? And now blood won't flow through it, so you're not going to get oxygen, and tissue is going to die off from a condition called ischemia, and that's what this is. So this is the most common reason for a heart attack, the most common stroke, the most common reason for kidney disease is these clots, these plaques, and then following that, a clot where the blood doesn't flow through. Okay, and it all starts with diabetes. All right, yeah, so now we're talking about, okay, ischemic heart disease. The chest pain is because you have pain receptors in your heart When you don't get oxygen flowing in there, they fire to let the brain know, hey, we got a problem down here, and then it will increase heart rate and try and compensate with that. Um, if the ischemia is bad enough, then the heart tissue doesn't have oxygen, doesn't have the glucose, and it begins to die off, and you then have a heart attack. All right. So it goes through all the different factors. So obesity is part of abdominal obesity, also called visceral fat. Okay, where you carry it out here. This, from the epidemiology, this is where we studied millions of people. This is the high risk group. Okay. Um, it is a combination of the effect of high glucose. And then what also happens is when you have all that visceral fat, the triglycerides, okay, the cholesterol, so these are both different contents in fat, they become elevated in your blood, and then they trigger this deposition in the blood vessels, okay? If your pipes are full of something like this, the same blood volume now is being coated with all this gooey stuff, all right? And so there's less volume for the blood, so the blood pressure skyrockets, and then that creates damage, okay? You can get this thing called an out pocket where it just goes whoosh, that's called an aneurysm. It can burst, you hemorrhage, boom, you're done, okay? Alrighty, so again, go through all this. It talks about everything that we were talking about, all right? Okay, so that is what is, okay? Other names for this, okay? So lots and lots of different things. Again, I just want you to think about our obesity epidemic, okay? We talked about insulin resistance, type 2 diabetes. So this is a predisposing factor, all right? Alrighty. Cause. Did I just say insulin resistance? Okay. Did we just talk about overweight and obesity? Your fat is your largest hormonal system in your body. And when you get overweight and when you get this abdominal visceral fat, the immune system will invade it and take up residence. And then it becomes this inflammatory organ. And inflammation is our enemy. Okay. SARS, okay, CoV-2 infection, okay, that results in COVID-19 disease is an over-inflammatory response. So all the people that have this pre-existing condition that I'm talking about right now have their set point of inflammation like this, okay, way beyond what is normal. And it is the hyperinflammation that's causing people's lungs, kidneys, hearts, brains to have problems. Okay. All righty. So risk factors. Okay. All right. Abdominal obesity. All right. Screening and prevention. We got to do a blood test. What are we going to do in that blood test? I'm going to check you for diabetes. I did that last time. All right. You guys remember those tests? All right. We're going to look at our fasting blood glucose, 100. Okay. We're going to look at our glucose challenge test, 140, and then we're going to look at our hemoglobin A1C or the A1C test, 3. Okay, you don't want to be over 3. All right, those are risk factors because we've done again millions of people, and you do the statistics and epidemiology, and we know that those are the tipping points for having stroke, heart attack, kidney loss, and all this kind of stuff. All right. So symptoms and complications, okay? Heart disease because the blood's not flowing to the heart, all right? Stroke because blood's not flowing to the brain, all right? High blood pressure is a measure. That's a readout. That's part of my screening up here, okay? Treatment, we got to lower your blood glucose. We got to lower your blood pressure, okay? We'll do this with special drugs if you want. How about some exercise? Oh my God, okay. How about changing your lifestyle? That has to be numero uno suggestion from the doctor, all right? We can go to medicines. There's no doubt about that, but let's not smoke. Let's figure out ways to reduce our stress. It was a beautiful day today, do your social distancing and go to the ocean, okay? Exercise. I went for a 2-hour walk with Julia today, okay? You got to do all these different things, okay? It's clear. How do we know that? We do the epidemiology. We study millions of people, and we do the statistics of out it comes. If you can't do this, or if you're just genetically screwed, which sometimes happens, then we can give you drugs that will control your diabetes. We can give you drugs that will control your heart problems and control your cholesterol levels. All right. All righty. And I'm going to go back here. Okay. And I want to go back in terms of the diagnosis. Okay. When we're talking blood tests, okay, I do want to mention that we have triglycerides. Okay. Want to keep those below 100. We have different types of cholesterol. HDL. H, what does that stand for? H stands for happy. Happy, 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 happy. Okay. You want your HDLs to be higher. Okay. How you do that? Reduce your stress. Okay. How you do that? You exercise and you eat right. 40 is the cutoff. Okay. All right. High blood pressure. All right. You have it measured right there. Okay. All righty. That's just, again, it's a readout. And then your blood glucose levels. Okay. All right. What's the other one? Okay. We not only try high triglycerides, but LDL. What is LDL? L stands for lousy. Okay. So you want to keep that below 100. All right. Please do that for me. All righty. Cool. We're going to treat you, like I said, with exercise, diet, and lowering your stress. This talks about living with this metabolic syndrome. It's important to be on top of this, basically. Okay. And right here, if all else fails, go to whatever disease condition you have. These clinical trials. Julia, at no fault of her own, had a really messed up immune system since she was a little child. She got leukemia. Okay. She went into a clinical trial at a major university medical center. Okay. And there you get state-of-the-art treatment. So do look into clinical trials and find out if you're a possible candidate. All righty? Cool. All right. So that's what that's all about. This again is the same thing. Okay. It's a a little bit. It's a PDF that you can read. Okay. Look at this concept of atherosclerosis. You see that right there? What is that? That's an immune system cell. It's inflammation. Okay. So the immune system goes wrong because you've candy coated all your proteins with the diabetes. Like I said, okay, you have all this LDL, lousy LDL, because of the high glucose and the lipids being elevated. It creates this super oxidative environment. That's where you're taking your antioxidants. I know you guys eat your kale. I know you do it. Okay, the reason you're doing that is because all that oxidation and all that glucose attachment or glycation, the immune system flips out and it overreacts and it creates this plaque. All right. And this is what these two videos is all about. So do watch them. And this shows you, again, the development of the plaque. Okay. These are these surface cells that are basically the kind of interactive surface. Okay. The barrier between your blood and all the tissue up here. All right. So they're sitting there monitoring everything, and they can get screwed up and they get activated right here by, what does that say? It says inflammatory cells. Okay. And this just shows you the progression. The messengers, okay, that are inflammatory are called cytokines. They're produced by your white blood cells, your immune system cells that are in your blood. Okay. And having inflammation go south is a big part of many diseases. Many of the clinical trials for COVID-19 are trying to slow down these white blood cells, trying to reduce the action of these cytokines so you don't get this overreaction that happens inside your lungs, inside your brain. Okay, so that's what this is all about. These are all these different types of white blood cells, okay, that contribute to this inflammatory response. All right. All right. That's the monocyte that they were talking about there. That's the key player in inflammation that causes disease. All right. All righty. So that's a lot. So again, what do? You always open your quiz and do it simultaneously. Okay. Now, all these diseases I've been talking about, cancer, diabetes, diabetic heart disease, and then Alzheimer's, social workers are your kind of life manager. All right. that because navigating the medical system can be a nightmare, even for somebody like myself, someone like Julia, we're well educated, that navigating our insurance and the clinical trial was so much work. And sometimes a social worker, they bring together all agencies: physical therapy, occupational therapy, dietitian. Okay, they'll point you in the right direction of the different independent physicians that are necessary for your care. Social workers are the bomb. All right, they're going to do in-home assessments. Okay, to make sure that you're okay. Um, Sadly, society does not pay a whole lot for this career trajectory, but they do so many things. Okay, they're the intermediary that makes life a little bit easier. All right, so you have to have a strong desire to help other people. Okay, you're going to assess the client situation. Like I said, the salary is not great. You're going to refer people to the exact partners that are going to help them out. Okay, um, and we need them to be highly certified, right? Because this is an important job, all right? And then this shows you all the different types of um, professional tracks that social workers live in, all right? So not only this part right here, which is a family service agency for the caregiving, well-being, somebody that has metabolic syndrome. Social workers work in school, child protection agencies, okay? They work in prisons, all right? Community centers. So many hospitals, and I put it right there, have social workers. They have to have it, okay? And then you can go into private practicing as well, all right? So very, very cool. All right, guys. So I want you to deal with my prompt. I want you to think about how important social workers are. And I also want you to consider the fact that someday there's a good chance that you're going to be using them. All right. So with that, keep your eye on the prize, guys. You guys are almost there. Sadly, okay, we're going to have our second critical thinking assignment coming up June 22nd, not too far away. All right. I'll be giving an instructional video on that one as well to get you there. And again, since you're home, it's time to start thinking about the paper as well. Click in here and start drafting your paper. It's going to be, don't forget when you do this paper, if you do have an older loved one, take out your iPhone and record for posterity so that your grandchildren, your great grandchildren can learn from the family culture that your parents or grandparents are going to be offering them. All right, guys? So at that, I am going to say adios, and we'll see you guys next week.